On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled Promoting the Safe Use of Post-Surgical Opioids, Health Literate Resources from POSSE. My name is Jeff Bomboy, and I will be your moderator for this program. Now I would like to introduce our speaker for the webinar. Susan Cosgrove is the Director of Health Literacy for the Healthcare Improvement Foundation, a nonprofit organization located in Philadelphia, Pennsylvania. She currently leads HCIF's regional and statewide health literacy efforts to empower consumers, educate providers, and build multi-stakeholder coalitions addressing health communication. She brings her health literacy expertise to other HCIF initiatives related to opioid, surgical stewardship, and chronic disease prevention and management. Susan, I will now turn the program over to you.
Thanks, Jeff, and thanks for having me. I'm excited to be here with all of you this afternoon to share some of the work that we've been doing related to health literacy and to opioid surgical stewardship specifically. So today's learning objectives are to define health literacy, what it is, why it matters, and how it impacts your patients. To describe the basic principles of health literate materials development and design and the importance of involving patients in that process. And then at the end of this webinar, you will gain access to a suite of patient-friendly health literate materials that are related to surgery, tips for implementing and disseminating them, and communication practices for reinforcing those written materials. And so before we start talking about health literacy, just a little bit more about my organization, the Healthcare Improvement Foundation. So we're an independent nonprofit organization. We are located in Philadelphia, but we work statewide and increasingly in other regions as well. And we drive high-value healthcare through stakeholder collaboration and targeted quality improvement initiatives with a real focus on healthcare quality improvement, patient safety, and population health. And our goal is to, through collaboration, create a responsive, coordinated healthcare community that fulfills the needs of patients and consumers and achieves better health. Health literacy is one of the many programs in our portfolio, as well as the Pennsylvania Opioid Surgical Stewardship Enterprise, or POSSE, which I'll be talking about later on in my presentation. And so to begin, we will start by talking about health literacy today. So I think we know that the healthcare process is extremely complex, and for patients trying to navigate the healthcare system, there are lots of steps along the way where they can get lost. So, you know, in order to successfully navigate the healthcare system, a patient needs to understand, you know, they need to sort of call to make an appointment. They need to understand their insurance, the benefits that are available to them, the providers that are in network or out of network. They have to make the appointment. They have to get to their appointment. They have to know what to bring, if they need certain documents, if they need a referral, if they need a prior authorization. And then, of course, you know, once the patient is in the exam room or having an encounter with a provider, you know, everything that goes into that, they need to be able to clearly articulate kind of the issues that they're having. They need to be able to communicate with their provider to listen and understand the information that they're receiving, which could be verbal or could be written. And then they need to be able to follow up. So whether that's scheduling a follow-up appointment or going to the pharmacy or taking a medication appropriately, we know that there are many steps kind of along this continuum and this process where patients can get confused, they can get lost, where health literacy really plays a critical role in ensuring the successful navigation of the system and receipt of care. And what we find is that communication challenges can make it very challenging to navigate this process. And again, you know, coming back to this idea that there are sort of multiple steps along the way where patients can fall through the cracks. You know, so if a patient is asked to sort of complete very complex, confusing forms that they don't understand, they might not be able to provide you with the information that you need to provide them with the best possible care. They may not understand the information that's being communicated to them if it's spoken to them using language like medical jargon or other terms that they're unfamiliar with. And when patients don't understand their care, what we see is that they can get caught in a continuum of confusion and fall into a cycle of crisis care, where what we want to see is a patient establishing a strong relationship with their primary care provider and being able to sort of attend to their routine care needs, as opposed to sort of going in and out of the hospital or using the emergency room for primary care and again, falling into the cycle of crisis care. And health literacy, again, is a real opportunity, I think, for us to intervene and to ensure that understanding is not a barrier to patients getting the care that they need. So what is health literacy? There are a lot of different definitions for health literacy out there. It is the degree to which individuals have the capacity to obtain, process, and understand basic information and services needed to make appropriate decisions regarding their health. That definition is in and of itself not very health literate. So, sometimes we like to say that health literacy is the ability to read, understand, and act on health information effectively. And functional health literacy is the ability to apply reading and numeracy skills in a healthcare setting. And one thing that I want to highlight here is that I think we are seeing a shift in the field of health literacy a little bit away from this definition and away from this individual deficit model where health literacy is what happens on the patient level. And as I talk about kind of some of the factors that influence that, we'll get into sort of how it really is a systemic issue as well and is situational too. So who does health literacy impact? Certainly, there are more groups that are more vulnerable to experiencing communication challenges. So groups that are at, you are at greater risk for low health literacy if you're Black, Hispanic, an older adult, or a non-native English speaker. But the takeaway here is that almost everyone is at risk. So if you look at literacy assessments in the United States, only about 10% of adults have a proficient level of health literacy, which is what is required to successfully navigate every aspect or component of the healthcare system. So we're talking about 90% of the population, the vast majority of the population is going to at some point have a challenge around health literacy or struggle to understand health information that's presented to them. And what influences or impacts health literacy? So as I mentioned, there are personal or individual or demographic characteristics that can certainly increase a person's risk. So experience with the health system is a big one. General literacy and education level is another big one. Cultural and language factors also play a role. And then stress, emotional factors, fatigue, illness, and medications. It's just harder to understand information if you're not feeling well, if you're tired, if you're on a medication that makes you feel a little bit loopy or affects your cognitive abilities. All of these things make it more challenging to understand. And then we also know that older adults are also at higher risk for low health literacy. And so you take those individual characteristics and you combine them with a healthcare system that's extremely complex, and that information is often communicated in a way that patients can't understand. Additionally, for patients that are navigating a physical space, signage, directions, and navigation can contribute to this as well. So if a patient kind of enters your campus and is not able to find the office where they need to go, they kind of are showing up to their appointment a few minutes late, they're already stressed, like that impacts this. I think that telehealth and technology bring a whole other level of anxiety for some patients to this, having to kind of figure out what app they need, how to navigate it, how to set up their video for a telehealth visit. And then, of course, time is a factor as well. So healthcare visits have gotten shorter and shorter, and patients feel a lot of pressure, to kind of be able to communicate what they need in a very short period of time. So all of these kind of factor health literacy and patients' experience of the visit. And health literacy matters because it's a stronger predictor of an individual's health status than age, income, employment status, education level, or racial or ethnic group. There have been several studies that have indicated this, and according to NASM, efforts to improve quality, reduce disparities, and reduce costs cannot succeed without improving health literacy. So health literacy is considered extremely critical to patient safety and to quality improvement efforts as well. On an individual level, we know that low health literacy can lead to lower health knowledge and less healthy behaviors, underutilization of preventive services, and overutilization of emergency services, like I discussed earlier, getting caught in that cycle of crisis care. Overall poorer health outcomes and greater mortality, particularly for older populations, needless patient suffering, and greater healthcare costs through repeated hospitalizations or overutilization of specific services. So we also know that there are specific communication techniques that can enhance health literacy and that can help address some of these challenges. So what can we do to improve health literacy? Healthcare should be delivered as if everyone has limited literacy, the universal precautions approach. So we do not recommend screening patients for health literacy because it's very dynamic. It can change even throughout the course of a single visit. Like a patient can enter the visit, get checked in. If they were screened for health literacy at that point, you know, they could pass with flying colors. And then imagine that during the visit, the patient gets a new diagnosis that is scary or serious, and we can see a shift that then it becomes harder to understand information because of their mental state. So there are a lot of reasons we don't recommend screening. One is that it really doesn't give you a lot of information to inform the way that care is delivered. And there is also a high potential for patient harm or stigma or shame. And so we really recommend this universal precautions approach, that if you're delivering care as if everybody may at some point struggle to understand, it's going to improve care across the board and going to improve the experience for all of your patients. And remember, this really is something that all patients can struggle with. Up to 90% of patients may have trouble understanding health information, and even patients with higher literacy skills or a higher education level or who don't have some of the risk factors may not understand medical terms and conditions. And so providing patients with easy to understand information, verbally and written materials, we'll talk about all of that today, is a really key piece of this universal precautions approach. And so taking this universal precautions approach, implementing some of the health literacy best practices that we're going to talk about today, that can break patients out of that continuum of confusion, out of that cycle of crisis care, and really establish, you know, this cycle of care where the patient has access to the preventive services that they need, you know, has access to that primary care, and is not overutilizing emergency services inappropriately. Okay, so now we're going to get into some of the strategies to address health literacy. And what we're going to talk about today includes the universal precautions approach, which I already touched on, and creating a shame-free, blame-free environment that involves all staff. Improving interpersonal communication using techniques such as plain language and teach back or show me. And engaging patients to support your health literacy efforts. And then creating and using patient-friendly materials. So coming back to the universal precautions approach, and I really just want to emphasize this point. You know, we really want to deliver care as if everyone could have trouble understanding information, because it's just the fact that up to 90% of patients may have trouble understanding. And all patients appreciate receiving easy-to-understand health information. And so to implement this universal precautions approach, of course, you want to implement a lot of the communication techniques that we'll talk about today, but it's also about the culture of your organization and the environment. And so you want to create a shame-free and blame-free environment. And what this means is for your patients, you want to encourage questions and create an environment where patients feel comfortable asking questions. You want to let your clients or patients know that others have difficulty understanding too. They're not alone. It's not abnormal to feel confused about their care, and you really want to hear their concerns and problems. You want to hear if they don't understand what they need to do to take care of themselves. You always want to define medical jargon and scientific words if you must use them. And in general, this is very basic, but you want to show respect for your patients and protect them from embarrassment in front of others. So really being aware that there's a lot of stigma and shame that can be associated with issues of literacy and health literacy. And you want to do what you can to mitigate that so that patients are not feeling that shame or that stigma or that embarrassment. And then a blame-free environment, you know, really refers to kind of what's happening internally, you know, with your staff. So you want to foster an expectation of collaboration across ranks, and you want to set the expectation that staff at all levels of your organization plays a role in creating this blame-free, shame-free, health-literate environment. And you want to establish a willingness of the organization to direct resources to reduce health literacy demands. These are practices that are recommended by AHRQ, and they actually have a great resource, the AHRQ Universal Precautions Toolkit, that I would highly recommend. It's a collection of 21 different tools that can help you with assessing and implementing health literacy at your organization. Okay, so to get into some of the specific techniques that we recommend to really improve interpersonal communication, I want to start by talking about teach back. So some of you may be familiar with this. I think every time, we do a training on health literacy or a presentation, increasingly over the years, we see more and more people that are familiar with TeachBack or are already using it. So if you're already using TeachBack, that's fantastic. But TeachBack is a method of confirming understanding with your patient. And one thing that's critical is that it's not a test of the patient. And there are ways to do TeachBack so that it doesn't feel like you're quizzing or testing your patient, but it really is a test of you as the provider and how clearly you communicated information. So when you're doing TeachBack, you have your teaching moments. You're explaining to your patient how they are going to take their medications, for example, how they're going to manage their pain after surgery. And then you have the opportunity to assess whether your patient understands what they need to do. And you want to, again, do this in a way that doesn't feel like a test of the patient. So there are different scripts or questions that you can ask, but they focus on putting the onus on yourself as the provider. So saying something like, I want to make sure that I communicated clearly, or I want to make sure that I told you in a way that you can understand what you need to do. Can you tell me how you're going to explain your pain management plan to your spouse when you get home after your surgery? And then it gives you the opportunity to listen to what the patient tells you and to clarify if there are any misunderstandings or anything that the patient forgot. And then you can reach that mutual understanding where you can feel confident that your patient knows what they need to do to take care of themselves. And the patient leaves the encounter feeling empowered because they feel like they understand as well. And so some possible scripts that you can use to initiate TeachBack. So I mentioned one of these already. I want to make sure that I explained it correctly. Can you tell me in your own words what we talked about today? Or what will you tell your spouse about your condition? How will you make this work when you get home? We've gone over a lot of information today. Can you tell me what we discussed? So these are all really sort of simple, non-judgmental ways that you can initiate this conversation with a patient without kind of making it feel like a test or kind of making them feel, ashamed or embarrassed, that it really is just a check. I just want to make sure that we're on the same page today. So another technique that we recommend is using plain language. This works really well in conjunction with TeachBack. So plain language or living room language makes written and oral information easier to understand. And this is essentially just speaking like you're a human, speaking conversationally, speaking like you're talking to a friend or a family member who is not in the medical profession. You're using simple language and, when possible, avoiding medical jargon or complex terms. If you must use a technical term or if you must use jargon, which is absolutely unavoidable sometimes, you want to define that term or clearly explain what it means. And then you always want to use the active voice if you're communicating to a patient, actions that they need to take or what you would like them to do. And then in addition to just the words that you're using to communicate, you also want to limit information to the most important points. So think about, what your patient wants and needs to know. When they're discharged from the hospital, what are the most important things that they need to do to take care of themselves? And then you want to organize the information that you're giving them, whether you're giving it to them verbally or whether it's written down on a page or on a material, so that the important points come first. And you want to break complex information into understandable chunks. And this is really critical. We know from the literature that patients forget up to 40 to 80% of the information that they receive in a visit, like by the time they reach the elevator bank if they're leaving an office. And we also know that the more information that is communicated to a patient in any single visit, the less information that they understand. So limiting information to the most important points is a really critical technique in ensuring that patients really understand what they need to know and what they need to do to take care of themselves. And so when you think about, word substitutions, there are entire plain language thesauruses and dictionaries that I think can be really helpful, particularly when you're working in the written communication space. But just think about how to simplify your language. So instead of saying something like adverse, you could say bad or harmful or hurtful. Instead of mortality, you could say death, narcotic, you could say addictive pain medicine or drug. And I think that one important point here, too, is that, a word doesn't have to be jargon for it to be hard to understand. Like, think about what the words positive and negative mean in kind of everyday context versus what they mean in a medical context. So if you call your patient and tell them that their test came back positive, think about how that could maybe be misinterpreted. It could be misinterpreted as everything's okay when what it means is we need to follow up and we need to think about a treatment plan. So even words that are sort of most people would recognize or be familiar with in everyday language can be used differently in the healthcare context, and it's important to consider kind of all of that when you're thinking about how you're communicating information to patients. And then finally, in terms of really, creating a health literate environment, engaging patients is absolutely critical. And engaging a patient and family advisory council really helps healthcare organizations understand what patients and families want and need when receiving care. And patient and family advisors can offer a lot of different things. They have a different perspective on an organization's or provider's strengths and weaknesses that they can offer. They can provide feedback on practices, policies, materials. They can give you a fuller picture of the care experience than your surveys provide. They can help you with things like assessment, like what is the experience of kind of from setting up an appointment to walking through the door. You can engage patient and family advisors to do those kinds of walkthroughs and give you that feedback to identify some of the things here. And PFAS results in better systems and processes of care, and we see a lot of long-term benefits of engaging patient and family advisors in this coordinated way. So ultimately, we see better health outcomes for patients overall. We see fewer errors and reduced risk, increased patient engagement and loyalty, and then I feel like this is really important. You see increased employee satisfaction. Again, this is all according to AHRQ's guidelines and research, but sort of at all levels, you see this positive impact of engaging patients in this way. And PFAS can support health literacy specifically. So patient and family advisors can provide detailed feedback on patient-provider communication. They can do this for oral communication. They can do this for written communication, such as reviewing educational materials to ensure that they are patient-friendly. They can identify, care processes that are confusing or unclear. Sharing first-person patient stories about health literate care and the impact it had on them can be really, really powerful. And they can really ensure that the voices of patients and families are part of planning and decision-making more broadly within your organization. Okay. So we're going to move into talking a little bit about patient-friendly materials specifically. So what do they look like? How can you assess them? How can you ensure that the materials that your organization is generating and disseminating are health literate and patient-friendly? So patient-friendly education materials are easy to read and understand. They appeal to the intended audience. So your audience can pick up the material, the brochure, watch the video, and it speaks to them. They feel like it's for them. This is for me. And they convey a clear and simple message. And I think the key takeaway here is that your material is patient-friendly when your intended audience says that it is. So again, coming back to the importance of engaging patient and family advisors here, you can use every assessment tool in the book. You can kind of do readability formulas. You can get the readability level down to be very simple, like 4th to 5th grade. Your assessments look great. The material is very actionable. It's easy to understand. And you could still hand it to a patient, and the patient could say, I don't get this, or this isn't for me. This looks like it's for someone else, or if you gave this to me, I would just kind of toss it. And that feedback is so critical. Like, there really is no substitute for getting that direct input from patients to tell you, like, yes, this is something that I would engage with. This is something that I would look at versus this is something that still doesn't quite speak to me or doesn't feel right to me. So there are several considerations for creating patient-friendly materials. So I'm going to get into each of these on subsequent slides, but you want to define and involve your audience. You want to select the right format for that audience. And then you want to write your material using the easy-to-read best practices, and then you want to make sure that you're doing quality assurance checks. So for defining and involving your audience, you want to identify, different audience characteristics like age, gender, and culture, and certainly consider literacy levels and readiness to learn or change. And our recommendation is generally that if you are not sure about the literacy level of the population that you are writing for, you want to assume that they have low health literacy. So the assumption is low health literacy unless you have an abundance of evidence to indicate otherwise. You want to think about which learning theories apply to the groups that you're writing for, and then include patients in the planning and writing phases of the material. And I will say that sometimes if you're defining your audience, sometimes a broader audience is actually the hardest to write for. Like if you know that, for example, you're writing a material on mammography and you know that your audience is going to be, women over a certain age or older women, that can actually be a little bit easier than if you're thinking about resources for something like, a post-surgical population that can be much broader, kind of all genders, all ages. Sometimes that can be the hardest to kind of pinpoint, the messages that you need to convey, how you need to convey them, the visuals that you need to use. And so the characteristics of the primary audience for the POSSE patient education materials that I am going to introduce at the end of this presentation, they are for patients that have recently had or are scheduled for surgery in the near future. Our audience is diverse in age, racial or ethnic background, gender, and culture. Again, coming back to this point of not knowing the health literacy levels, so assuming low to average. And we know that this audience may have concerns about opioid use or may have had personal experience with the opioid epidemic that we want to be sensitive to when we're writing these materials. So again, coming back to this idea that a broad audience can be quite challenging to write for. And so the next step, once you've defined your audience, is you want to think about the best format for your audience. So formats could include, a description or a story, a Q&A, or an FAQ. So it's kind of about how the information is presented. And it's also about the format in terms of, is it a written material? Is it a brochure or pamphlet? Is it a one-pager? Is it a podcast? Is it a video? And then in terms of format, if you can, you want to include interaction. And so, for a written material, this often means having a Q&A, having a section where patients can write down their questions or answers to their questions, a checklist, a self-assessment, kind of anything that encourages the patient to engage with that material in a meaningful way. And then you want to think about the visuals that you're using and include visuals if they are helpful, sort of if the visuals are helpful in helping the material look and feel like it's for a specific audience, or if they're helpful in that they are describing or demonstrating kind of a process or something that you want the patient to do. A note about kind of the materials that we developed here, so pictures and visuals can really be powerful, and particularly around opioid use, they can reinforce stigma or negative stereotypes around sensitive issues. So, when you see kind of an article in the news about opioid use, think about the visuals that usually accompany that. Are they depicting people who struggle with opioid use in a positive light, or are they kind of going back to these pictures that are very negative? And so you want to be sensitive to that. And of course, because we're talking about materials that are specific to opioid use here, that was our specific issue. But any sort of sensitive issue, you have to be careful about how you're using visuals. And the appropriate use of visuals, as I said, can help describe a process or model a behavior. A great example is like a visual with pictures of how to wash your hands and how to do that properly and well. And then the visuals can also reinforce the written material, and you want them to be relevant to your audience, and you want to focus on the positive. So you really want to focus on the behavior that your material is encouraging. So you wouldn't want to, for example, have a paragraph about how you should not share your prescription medicine and then put a picture of two people sharing medication next to it. Like, you really want to focus on what it is that you want the patient to do and not include pictures that depict behaviors that you're trying to discourage. And then you want to limit the content and the message. So coming back to this idea of plain language absolutely applies to your written materials as well. So you want to limit information to the 3 to 4 most important points and explain the purpose and relevance of the content to the reader, and again, focus on the action that you want to promote, focus on what you want people to do, and think through this lens of what is the minimum content needed to give the reader the information and motivation needed to complete the desired action. What is the minimal amount of information that I can convey that will help my patient know what they need to do to take care of themselves, and then act on that information. So sometimes less really is more. Use plain language. Keep your language simple. When you're organizing written information, you want the important points to come first, and you want to break complex information into understandable chunks. So rather than having sort of long paragraphs of information where it's hard for patients to pull out what the most important point is, think about using bullet points. Think about using other formatting that makes it obvious if someone's skimming through the page what they need to know. You want to write in short sentences, so 10 to 15 words or less, and you want to keep paragraphs short, 3 to 5 sentences. So if you're looking at a material and you're trying to assess its readability, but you don't have time to sort of do a full readability assessment, those are some of the things that you want to look for. So if you're seeing short sentences that are like 10 words or less, the paragraphs are short. If you're seeing that there's not a lot of words that are like 3 syllables or more, that's a fairly good indication that the reading level might be appropriate for general audiences. And you want to keep your material visually simple from a design perspective. 12-point font is the minimum that you should use in written materials, and if the material is targeted for an older population, then size 14 or 16 font is really much better. You want to avoid any stylization of the text, so you want to avoid italics, underlining, or all caps unless you are using them in a very limited way for emphasis. And you want to keep the page uncluttered, so maintaining plenty of white space. And I know the instinct is, oh, it's better to have all the information on one page than 2 pages, even if it means kind of crowding the page, decreasing the font size. And I think what we know is that it's just better to have a 2-page material than to cram everything onto 1 page, because that's going to be a barrier. That's kind of like a wall for a patient. If they see a page that's just full of text or full of small text in particular, it's not inviting, it's not appealing, and people don't want to read that. It's better to have kind of your material appear longer or be multiple pages if it's more inviting and if it's encouraging patients to engage with it. So when we were working with patients for POSSE, one of the pieces of feedback that we got was that it's really critical to use non-glare or non-glossy paper that absorbs ink. The patient and family advisors that we worked with, they emphasized to us that they really like to write on their materials. They like to highlight the key points. They like to circle things. They appreciate it when their provider did that. And that's really hard to do if you're printing your materials on cardstock or on kind of a glossy brochure paper. So really ensuring that you're printing on a paper that can absorb ink and be written on. We heard that that was really critical. And then finally, from a design perspective, you want to use sharp contrast between the background and text colors. So you don't want to do light blue on slightly darker blue. You want to make sure that the contrast is there. And again, this is a consideration that's particularly important for older adults to be able to kind of read and clearly look at the material. And then finally, you want to conduct quality assurance checks. So you want to test the draft and the final material with a few patients. And these patients can provide you with more general feedback. So, they can look at the material and say, the text is too small, I'm having a hard time reading this, or the contrast isn't enough, it's hard for me to look at this, it hurts my eyes. But you can also give patients tools like some of the assessment tools that we're going to talk about to actually evaluate the material. So I think there are benefits to doing this both ways. You can really build your patient and family advisors' capacity to be the assessors for you, in addition to kind of getting their general feedback as well. And this is what we attempted to do with the patients that we were working with for POSSE. Anytime you're using assessment tools, you always want to do a dual review. You can kind of compare what different impressions of the material are. And then you always want to make sure that you're documenting the assessment results. So you can look back and see the last time that a material was assessed for readability or was assessed for content or was assessed for suitability for the audience. And so I just want to briefly highlight a few tools here that you can use for reviewing education materials. So we're not going to go into these too much, but these tools are both available online, and they do have, fairly easy to understand guides that can help you kind of practice and learn how to use them. So the first one that I want to highlight is AHRQ's Patient Education Materials Assessment Tool, or the PMAT. And so this is a checklist that evaluates and compares in 2 sections, sort of first the understandability of a material, so how easy it is to understand, and then the actionability of the material as sort of the key components that will tell you, how easy this material is to engage with. I don't remember exactly how many items it is, but again, it's a checklist where you mark yes or no, and then it will give you kind of a score that will tell you sort of where your areas for improvement are. And then the CDC's Clear Communication Index focuses on sort of research-based items that enhance clarity and aid understanding. And this provides a numerical score, and they actually have a cutoff for whether the material passes. So the PMAT doesn't have a specific cutoff, but it sort of tells you to look back at the areas where the material scored low, and that's where you would identify those areas for improvement. Whereas the Clear Communication Index has a cut point. I believe it is the material has to score 85% or higher for it to pass. And I will say, of all of the materials that I have reviewed, it's very rare for a material to pass the Clear Communication Index on the first try. And again, the recommendations for improving your material are to look back on the items where the material scored a 0 and to see if there are areas that you can improve. One of the things that I really like about the Clear Communication Index is that it has a cover sheet that asks you to identify things like your target audience and your key messages that you're trying to communicate. So it can be really helpful if you're developing a material to think through some of those things before you kind of get into the checklist component. And then finally, readability formulas are fairly easy to use methods for assessing reading difficulty of print materials. And again, they are based primarily on the number of multisyllable words and the sentence length of your material. So there are a lot of different ways to do readability formulas. I think one that a lot of people are familiar with is really the Flesch-Kincaid method that is available through Microsoft Word. And I would say if you're using that method, you just want to make sure that you're preparing your text ahead of time, and you want to pay attention to kind of, if you have things like headings or bullet points or incomplete sentences, those can artificially alter the reading level that tool spits out. So some general recommendations for using these tools is that you want to use more than one tool to get that broader assessment. So for example, use a readability formula and use the PMAT, or also use the Clear Communication Index. And you want to make sure that the assessment method that you're using is suitable for the length and format of your material. So I know the PMAT specifically has a version for AV materials and has a version for written materials. Different readability formulas are intended for different lengths of text or different formats of text, so you always want to make sure that it matches up with what you're trying to assess. Again, using more than one viewer is critical, and then relying on feedback from the intended audience as to whether the material is clear and effective is critical as well. Okay. So with that, I'm going to talk about the resources that we developed for POSSE. And so POSSE, as I said, is the Pennsylvania Opioid Surgical Stewardship Enterprise. This was a 24-month collaborative funded by AmerisourceBergen Foundation. Our first period of funding just ended at the end of August this year, but we actually were renewed for another 2 years of funding. So we're entering kind of our second funding cycle and just kind of in the very early months of that. And this is a partnership between HCIF and the Pennsylvania NSQIP Consortium, or PANC. And for POSSE, we identified patient and provider-centered domains to focus on preventing post-operative opioid abuse. And so our patient-centered domain program goals were to promote health literacy and patient-provider communication related to opioid use and pain management, and also to increase the number of health literate patient education materials that were available to the hospitals that we were working with as part of POSSE. And our strategies to do this, as I mentioned, we were lucky enough to engage patient and family advisors that provided feedback on existing patient education materials. So we sort of gathered all of the education materials that hospitals were currently using, and then had kind of our patient and family advisors provide some feedback on them. We offer technical assistance for materials revision, and then we developed a suite of surgery-specific health literate patient-reviewed education materials, which I'm going to share with you now. So the materials that we developed included a patient education video. It's just shy of 5 minutes long. It's about managing your pain after you have surgery, so it talks about general pain management as well as opioid use. We also developed 5 companion materials to reinforce key messages for that video. So 2 brochures. One is generally about managing your pain with a brief, touches briefly on opioids. One is specifically about opioids. This is actually a recommendation from our patient and family advisors to sort of split this up into 2 different materials. We have a questions to ask insert for those brochures that calls back to questions that are recommended in the video, so reinforcing that message. We also have a taking opioids after you have surgery, frequently asked questions one-pager, so it's a lot of the same information as the brochure, but just in a slightly different format. And then we also have a disposal card to help patients look up where they can get rid of unused medication. And then we also provided our hospitals with a dissemination plan to assist them with implementing these materials. So I'm not going to show the video. This is just kind of the intro clip that shows like the different patients that are featured in the video. As I mentioned, it's just shy of 5 minutes long. It is publicly available on HCIF's YouTube channel, and I think that Shelley's going to share the link to all of these resources either in the chat or kind of after this webinar so you can access them. And then here's just an example of some of the written materials. So this is the Managing Pain After Surgery with Opioids brochure that we developed. So it's a little bit small to see on the screen here, but I just want to highlight, some of the components of this. So, one of the things that was really important to include, from our patients is we see on the back here, we have this area where patients can take notes. They can write the name of their doctor and the name of their pharmacy. And then inside, we also have like an opioid safety plan where patients can check off the actions that they're willing to take. So such as like taking my medication only as directed, keeping medication in its original package, tracking how much I have left, where you're going to store it. So it really encourages patients to engage with this material and to come up with a plan ahead of time for how they're going to manage their pain and how they're going to safely use opioids if they choose to do so. And then on the left-hand side here, you have an example of this disposal card. So this is intended to be printed about business card size. Has a link to a site where patients can go to look up their disposal sites, and then also has the link to the video as well. And then we have this questions about my medication. So, you can see on the left-hand side here, it has this older gentleman who's actually a character from the video, and these are the questions that he's thinking about and asking in the video. So it's really calling back to that to try to reinforce those messages and kind of, remind patients about these questions, like how much pain should I expect after my surgery, what type of pain will I have, what medications will I take, and so they can prepare ahead of time and know this information, when they leave their pre-surgical checkup. And so I'm just going to end here by sharing some ideas for implementation. So if you access these materials and you are interested in implementing them at your hospital, a good first step would be to share them with your hospital's patient education committee or department, to get marketing and communications involved, or your quality department, so just try to engage different departments that play a role in patient education for review and dissemination. And we strongly recommend introducing these materials prior to surgery. You can also consider adding a box to the checklist to document that, you had a conversation about post-operative pain management and opioid use and that these materials were a part of it. So, again, just taking the opportunity to reinforce this information at every step. So you don't want to be introducing this information to patients for the first time when they're kind of coming out of surgery, feeling groggy, feeling in pain. Like you want to have these conversations and have this plan set ahead of time. And so again, reinforcing key messages by reviewing the materials after surgery, and just reminding patients that, hey, there's a video available to you if you haven't watched it yet, feel free to go watch it on YouTube. And then if there are other ways that you're disseminating materials, like for example, if you're doing some of your visits via telehealth, you can add the video and printed material files to websites, where you host surgery-related downloadable forms or other materials that you send patients to. And then for the video specifically for implementing this, you might want to consider how you are already incorporating video content into patient education if you are. So for example, if you're using tablets at the bedside, you could incorporate it there. If you have videos available in the patient portal, that would be another option. You could put it on your hospital website. So, again, just thinking about how you might already have video content available and incorporating this there. The video link is on all of the printed materials so that, we're encouraging patients to kind of access that. As I said, the YouTube video is publicly available, so, you can share that with patients if you want. You can share that within your institution. And then you can encourage the patients or your patients to sort of share these materials with their family and friends, particularly if they have a caregiver, someone who's going to be picking them up from their surgery or someone who's going to be caring for them at home after surgery. You would really want to encourage them to share this information with that person. And then for the written materials, we always recommend written materials as a reinforcement to a conversation. So, rather than just handing patients the materials and expecting them to, read them on your own, you're having a conversation about pain expectation and pain management, and you're using these materials as a tool to reinforce and remind patients the key points from that conversation. We talked a lot about taking notes already and how we heard directly from patients that this was something that they really appreciated and that was really critical. And, accordingly print on non-glossy paper so that the ink doesn't smear and so that patients can actually write on the materials. And you yourself can reinforce key messages by circling sections or writing on the brochure yourself. And patient advisors shared with us that the value of these materials and these documents increases when it's personalized for them. So if their doctor circles a message on one of the materials or writes on it or something, it increases the value of that material significantly to them. Like they are going to take it home, they're going to use it, they're going to revisit it. Again, highlighting the link to the patient education material, and then, of course, we talked about earlier in this presentation using teachback, and so using teachback to confirm understanding and asking open-ended questions to make sure that your patients have the information they need to take care of themselves. And then I just want to highlight one more resource that we have available on the PANC POSSE website. So this is a broader educational toolkit for providers specifically. And the target audience for this is surgical providers, care teams, and anyone else who works directly with surgical patients. And it really is a very comprehensive resource that we just kind of created this year that takes a multifaceted approach to opioid surgical stewardship and covers a lot of different topics, in this realm, from the history about the opioid epidemic to really how to implement opioid surgical stewardship initiatives, in your institution. And it includes external resources, trainings, tools, and evidence about a series of topics related to opioid use in surgical practice. So I would say that this is a really great resource if you are seeking to get sort of opioid stewardship initiatives off the ground at your organization. I would certainly recommend checking this out as well. So I think with that, Jeff, I'm going to hand it back to you for some Q&A.
Okay, thanks, Susan. That concludes the slide presentation portion of our program. Just as a reminder, as Susan noted, some of the resources that she mentioned are available in the chat box on the screen in front of you. Now we would like to begin our question and answer period. If you have questions, please type them in the Q&A box found at the bottom of your screen. Please click on the three dots, then click Q&A to open the Q&A panel and direct your questions to all panelists, and we will try to answer as many questions as we can. Okay, we do have one question that says, how do I know if my patients have low health literacy?
Yeah, thanks, Jeff. That's a great question. And I think that, again, we recommend the universal precautions approach. And I think the question of screening is really challenging. It's one that we certainly get a lot. And I think it's something that we get with the best intentions. Like, people want to know if your patients have low health literacy because you want to be responsive to your patient needs. We don't recommend screening because of the potential of harm, and there are some red flags that you can look for to kind of know if maybe a patient is struggling to understand. Slower reading speed is one of them. You can think about non-adherence or non-compliance as maybe a potential signal of misunderstanding rather than sort of a patient just not doing what they need to do. But also patients who have low health literacy sometimes show no signs. Many of them don't show any of those red flags. And so that's why we really recommend taking this universal precautions approach where you are making all information available to your patients easy to understand. So you don't have to identify who has low health literacy. You don't have to introduce that potential for harm or for shame or for stigma that can come with screening because you're meeting their needs because of the way that you just do things and the way that you deliver care is very health literate and patient friendly.
Thanks, Susan. Another question. I want to start reviewing my patient education materials to see if they're health literate. What are the first steps?
Yeah, so this is a big undertaking, and we've certainly worked with clinical partners that have decided that this is something that they need to do. And I would say the first step is sort of inventorying what is out there and what you have, and I think it just varies a lot. Like we work with some clinical partners where all of the education is sort of available through the EHR, and that's all that they are really supposed to be using, like system-wide, so it's very standardized. And we work with some clinical partners where it's a combination, where there might be materials available in the EHR, but then also each individual site may have developed sort of some homegrown materials that have, existed for a long time or have been photocopied over and over again. So I think the first step is kind of assessing what's out there, assessing what you have, assessing whether you have a standardized approach to materials development and review. And then going from there. And I think once you have a sense of what's out there, then you can kind of pull together that plan for assessing or for standardizing, or for developing a policy even that helps clearly articulate, what the standards of your materials will be going forward.
Okay, we have another question. Using plain language is key, but how do we simplify content without losing the message or changing the message?
Yeah, that's a great question, and I think that one counter to that is, and it also speaks to the benefit of having patients review materials and getting that feedback is your message what you actually think that it is? So sometimes a more complex message we think it says and is conveying what we think, but then when you put it in front of a patient will tell you something totally different. So I think that is like one thing that I would point to is that, first of all, it's possible that materials that are written at a high reading level or are very complex are actually not conveying the really critical information that you want to convey in the first place. I think there's a lot of concern with the use of plain language and written materials in particular that, you might get some pushback from patients that feel like things are like being too oversimplified for them or something like that. We really haven't found that generally to be the case. And I think the other thing is that, if you're engaging a patient in their care, like you can do that in a way where you can kind of assess a little bit where they're at. So for example, you could say, tell me what you know about taking opioids, or tell me what your concerns are about taking opioids. And so you're opening up that conversation by establishing like the baseline level of information that your patient has, and you can build the conversation from there. So if they say, I have experience with opioids, or I'm not overly concerned about this, or if they say, I don't know, my sibling had opioid use disorder and I've seen what it can do and I'm really uncomfortable, it gives you that foundation to give patients the information that they want and need to know. And it just takes practice also, I think, to kind of get used to using plain language as the way that you communicate, and without losing that message and still communicating it clearly. I think you just get better at doing that over time, and as you kind of communicate with patients in that way and see what works and what doesn't, and what's clear and what's not.
Another question, have the POSSE patient education materials been tested or validated?
Yes, that is a great question, and I will say that they have not been validated, in any academic way. So certainly in the development process, as I mentioned, we engaged patients along that process, sort of multiple steps of the way. with the video, for example, you know, we engage patients to review the script. We engage patients to kind of look at the visuals. And so the final materials, we haven't done any, like a study on them to validate them, you know, but we feel pretty confident that based on kind of the clinical input we got from our different hospitals in the steering committee, the feedback that we got from our patients, the assessments that we ran on the materials, that they're very sound materials. But, you know, certainly we welcome sort of feedback if you decide to implement them at your hospital and you get feedback on kind of how effective they are.
And our question is, how can I assess these materials and use these materials? And I think that Shelley did put them in the chat box, the resources that you mentioned, Susan.
Yeah, so if Shelley put a link to the resources in the chat box, that's great. And so the link you can also, if you Google like PANC, P-A-N-C, POSSE, you should be able to find the PANC website, and all of the materials are publicly available there. So it includes all the brochures that I mentioned. It includes the link to the video. And then it does have like a detailed dissemination plan, which I shared some of the high-level points here. But that includes even like scripts for having the conversations using the materials. So I would say, you know, go there, take a look at that, you know, certainly look at the dissemination plan, think about how you can implement them, and then I'm certainly happy to share my contact information. I think it might even be on the materials on the site if you want to reach out to HCIF for more assistance if you're really interested in implementation.
Okay, we have one more question. How can my facility engage patients to support our health literacy efforts?
That's a good question, and it can be really challenging to do. I think increasingly, clinical organizations, hospitals, health systems, surgical facilities, I think increasingly this is a priority, like engaging patients in some capacity. But it does take some practice and it takes some effort, and we know from our POSSE hospitals, a lot of hospitals that you know, are kind of running patient and family advisory councils. Sometimes that falls to like the patient education department, and it's like one of many things that they're trying to do. So it can be a challenge, but there are a lot of great resources out there. Like I know AHRQ has one, I think IHI has one, like lots of handbooks and toolkits that really talk about if you want to engage patients specifically, how to do that. If you want to form a patient and family advisory council, you know, I really do think that the investment of time and resources when you do that ends up being worthwhile and ends up paying off. So it might not be something that happens overnight. It might take some legwork to identify the right champion within your organization to really lead the patient engagement. It might take some time to identify the right patients, you know, within your patient population that are going to give you the critical feedback that you need. But I think even if it's like a 1 year or 2 year or multi-year process, like in the end, it really does pay off in terms of the impact on health literacy, the impact on quality improvement, you know, that you'll see from having patient voices at the table.
I want to thank everyone for joining us today. If you experience any issues assessing the evaluation and/or certificate of continuing education, please feel free to direct any inquiries to Shelley Meixel at shmixell@pa.gov or contact the PSA support staff at 717-346-0469. This concludes our webinar. Thank you for attending.